My name is Jennifer Spicer, and I'm Chief Resident at Grady Hospital.
My name is Lucas Golub, one of the chief residents at Grady Memorial Hospital.
I went to Emory as a med student, actually, and I really enjoy training here, especially at Grady. The patient population is really diverse. You get a lot of autonomy, but you have a lot of support from all the attendings that you work with, and I really enjoyed it during that time and couldn't find another place that I enjoyed as much as here.
I decided to do my training at Emory mostly for Grady. It's a hospital that I love, that's near and dear to my heart, and I was here for medical school, had a good flavor of Grady, knew that this was where I wanted to stay, and actually didn't really apply or even interview anywhere else. I just knew this was where my heart was, so I chose to stay.
So the faculty here, unlike a lot of other places, they're completely on a teaching service. So they don't have any of their own services. They're not a hospitalist during other times doing their own work. So their entire job is to really teach all the residents here. So they come on service, they're the head of your team, and their entire focus is just figuring out how to teach you and how to make you a better physician.
The faculty, they're all medical educators. Everybody is here really dedicated to teaching patient care, and you really see that in the way that they're able to run the teams. These are people who take their education, their leadership, their interaction with residents and students very seriously. And I think that's another thing that makes Grady a really special place as a trainee. There's a real team atmosphere at Grady, from the physicians working with the patients, from the physicians working with each other as a team, and also with our nursing staff, every other provider at the hospital. I think it's a hospital that attracts people who want to be there. People aren't here punching the clock. They're here because they're passionate about taking care of patients, taking care of underserved patients. So people are really drawn to Grady. I think you feel that energy here.
I do feel like I'm prepared for the next step in training. I think in residency here, by the end of intern year, you just get to see so many different patients and so many presentations. And you really have the ability to make decisions on your own with support from other people. And I think that really helps you learn pretty quickly. And by midway through second year, I felt confident taking care of almost anybody in the hospital on my own with very little input. And definitely by the end of third year, I was definitely ready to go out and take care of people on my own.